Hello everyone, my name's Mo.
And I'm Camille.
And welcome to the Pareto podcast.
You're definitely going to enjoy this episode.
Absolutely.
Today, guys, we have a very special guest, Dr. Celestine. He'll be joining us to explain to us about his journey of becoming a medical doctor from Nigeria, studying in the Ukraine, and then working finally within the NHS as a GP trainee. I think you'll find it very, very interesting about his process, the challenges he overcame, his university studies, and now, working within the NHS as a GP trainee, what the challenges, what things he enjoys, and why he chose the UK, why he chose the NHS. Any sort of insights, tips, tricks, I'm hoping that he can give to our audience, I'm sure you very much appreciate. So without much further ado, I want to introduce you to Dr. Celestine, who can give potentially a quick introduction to himself.
Yeah, thank you for having me. My name is Celestine Okezenwafo. Originally from Nigeria, medical doctor. Moved down here quite a long time ago, 3 years ago, I would say.
Yeah.
And currently in the NHS.
Okay. So, that's quite a journey, isn't it? We work together in a professional capacity. So, I was always interested in your journey, being a few countries throughout the world. And, just tell me a little bit more about your journey, what sort of brought you down this path, being a medical doctor, and then we'll delve more into it and hopefully some interesting conversation.
So it all started, a long time ago, probably I would say 2004.
Once upon a time?
Yeah, exactly. When I finished my secondary school,
okay.
I had this discussion with my parents on what I wanted to do. Initially, I wanted to be an engineer, but along the line, I found out that being a doctor was what I wanted to do. I really love that passion to look after people and take care of people as well.
Yeah.
That made that decision for me, and it was easy for me to make that decision anyway.
Yeah.
I think where it lied then was where to go do this. I wanted to come to the UK.
Yeah.
But the cost of tuition then was so high. So we, did a little bit of research in other countries in Europe and ended up going to Ukraine.
Oh, Ukraine. Okay,
yeah.
So that's quite interesting.
Yeah.
Was there much of I'm guessing there was a culture difference between Nigeria, your home country, going to Ukraine. Is that the first time you traveled internationally, or?
Yeah, that was the first time traveling internationally.
Wow.
It was a big challenge though.
Yeah.
I think I was 19 years old then. And
19.
Yeah, it was, it was difficult.
Of course.
But yeah, I pulled through and here am I now. So yeah, I'm good.
So tell me a little bit about, obviously, you've come from Nigeria, you've decided to study medicine in the Ukraine. Tell me about, when you went there, what kind of expectations you had, what were the initial challenges, what went easier than you expect? I mean, big culture shock. You've got the language.
Very true.
You've got the food, climate. There's so many aspects. I mean, what did you initially, what were your expectations, what were your thoughts, and then what were your challenges once you got there?
At that young age, what keeps the drive going and what motivated me at that time was trying to be better.
Okay.
Because I knew that going there, I'll meet a lot of challenges where you meet a lot of people from different countries, different race.
Yeah.
I knew it wasn't going to be as easy as, being back home and, meeting the same kind of people where you are. I think the drive to want to be better, in as much as there are challenges, the culture part where you can't find, your food, your clothes and all that. And it was quite cold there as well.
Cold.
But I think the fact that I wanted to be what I want to be, I want to be a doctor and I want to be a good doctor for that matter. Yes.
And you felt
going.
You could get that education in Ukraine.
Exactly. So did well, did all my stuff and
okay. Yeah. So compared to, say, for example, the life you were living in Nigeria, were you quite, what kind of life, what would be a typical day at 19 years of age? And then what would be a typical day in med school in the Ukraine?
Yeah, I think it was Initially it was the cold, the weather.
The cold.
Yes, it was really cold there.
I suppose that's the first thing that hits you.
Yes, very much. Waking up in the morning, very cold, and trying to get yourself from where you're living down to school. It's quite a journey and really cold. But still, kept going. It was difficult there trying to get food items. So usually most of the food items we get, we are like shipped back to
really?
From Nigeria back to
really?
Ukraine. Yeah, just to keep us going. And
Okay.
after a while, mixed up with people and started having the food and enjoying the meals in Ukraine as well.
Okay, that's very good. So, in terms of the weather was initially a challenge. And, how often were you sort of, liaising with your parents back home? Were you going home regularly, or were you not?
I think I was not going regularly. I was going about once, twice a year.
Okay.
Yeah, which is all right. Some people had the privilege of going every year, but I wanted to go to other countries. So a year where I didn't go home, I traveled to other countries for holidays and for electives as well.
And obviously the second biggest, I think once you get over the initial cold shock therapy, I think the second biggest challenge would be the language. Did you feel that?
Yeah. So I'll go through the language part with you right now. So with the language, back there it's Russian, which is taught, as well as Ukrainian as well.
Okay.
So you can decide which area of language you want to be taught.
Okay.
Yeah, but originally what they speak Russian and Ukrainian. But I decided I want to study in English.
Okay.
Because I knew that I'm not going to remain there. I'm going to leave Ukraine, come to the UK, go to the US, stay in Nigeria. So I needed to still keep that language going, which is English.
Yeah.
But seeing patients, you need to know the language, because when you meet a patient, you need to know how to communicate with them.
Of course.
So you need to know how to speak Russian, or you need to know how to speak Ukrainian. So the positive thing there is, while you're there, they tend to, each year you have courses in this language. So that helped me. First year I had 4 classes every year. The second year it went to 3, then 2 and 1.
Okay.
And also, meeting friends and people outside.
Yeah, I mean, once you're immersed in a culture, I feel like, once you're in that position, you sink or swim, isn't it?
Exactly.
You have to learn.
Very
if you're
true.
going to the shop, you're going about your daily business, you need to bus route, you need to know the language.
Very true. And very importantly, knowing the language will help you in your medical career as
Of course, yeah. So, because you're going to have to interact with patients.
Very well.
They say the patient is the best textbook.
Very true.
So this is what we're trying to indulge onto our viewers as well, that without patients, you've never left the harbor.
No.
You need to venture into the ocean with patients as your guide, and they will enable you to fully become immersed in clinical medicine and learn, anatomy, learn, pathophysiology, learn. And this is all, your learning comes to life when you see a patient present in that manner that you've seen in the textbook. And once you take that history, once you do that examination. So I think that's very, very important. And so you learned the language, Ukrainian, I'm guessing?
I learned Russian.
You learned Russian?
Yeah.
So to any of our Russian viewers, do you want to say a little phrase if you remember anything at all?
Привет, или здравствуйте. Меня зовут Celestine Wafo. Я врач сейчас. Я люблю Украину очень большое, но я не нравится, что случилось сейчас там. Но я знаю, все будет нормально. Thank you.
Hopefully you guys got that, because I will need the subtitles later on. Well, thank you for that. So, and when you were there, how did you find the people, the education system? How was, ingraining yourself in that country?
Obviously it's different from being in the UK, where you have different race and you have different cultures. Around. It's more centered around the white folks. But they were very warmly embraced. They warmly embraced us coming in there. I was in a small city. And it was good. Going to the markets, going to school, and going to all the shops, and they were welcoming. It was good.
Okay. And so you took that medical education that you got from Ukraine. And then you decided that, out of all of the, once you have sought after medical education, you're skilled in this way, whether you're a medical doctor, you're a nurse, any number of the allied health professionals, you're very well skilled, and countries look for these kind of people, and they want to invite them, to work within their countries. So what pulled you towards the UK? What pulled you towards the NHS?
Okay, so it was a journey. I will start with being in medical school back in Ukraine. It's 6 years there compared to like 5 years here in the UK. So during the journey, I think my 4th, 5th year, I started thinking of what I'm going to do next.
Okay.
Do I want to go back home to work? Do I want to work in the US? Do I want to work in Australia? So I have to lay my table down, my options, and make a decision on what I want to do. So I used that time, I think my 4th, 5th year, I started planning. So obviously, being an immigrant, it's going to be difficult for you going to other countries to just work like that. You have to write exams. And you have to decide which of exams you want to write.
Which exam you want to take.
Exactly.
What a privilege.
Exactly. So, So I think at that time, I wanted to write a USMLE.
Okay.
I started studying for it.
Okay.
I wanted to be in the US then.
Okay.
I did the step 1.
Step
USMLE
1.
stuff.
So there's 2 steps, am I right?
Yeah, there are 3 steps.
3.
So you have the step 1, step 2, CS and CK.
Okay.
So I did this first step, graduated from Ukraine, then went back to Nigeria where I planned, I'm going to write the second step when I go to the US.
Yeah.
But along the line, I decided, I'm going to do my housemanship back home. So I did my housemanship back home after that.
So housemanship, for those that are not familiar, is that like a F1?
Yes.
So that's the first year
That's the foundation training, yes.
First year of practice as a qualified doctor.
Exactly.
Okay.
So, but living Ukraine, each country you go to, you have to write an exam.
Yeah.
I wrote an exam in Nigeria as well. It's not that easy. You just don't finish and just go back there and start working. No, you have to prove what you've learned and prove how qualified you are.
Okay.
So I wrote an exam back home in Nigeria, passed the exam, then started my foundation year.
Okay. And so in that process, you're considering America. When did the UK enter was that a friend or a colleague or?
Yeah, I think. Yeah, friends actually.
A romantic interest?
I wish. Actually, it was friends actually. What happened was where I was working back home, because I was still trying to get myself to the US, but it was taking longer. It's very cost effective, and all my mates and friends who I was working with, they've all left already.
Okay.
I started the journey before them. And before I know it, they've all gone to the UK and they're working already. I'm still struggling to get myself to the US.
Yeah.
I think I decided, it's time for... Initially, while I was in the US, I found out it was getting difficult. I started thinking of going to Australia as well.
Okay.
So I started going through materials from Australia and all that, asking questions. Everyone tells me that the UK is easiest. Like, it's easier to get yourself to the UK than trying all these options. But I was like, I'll leave it there. Let me try Australia. I think the fact that I've always visited the UK, I wanted somewhere else different. While I was in school in Ukraine, I always come down to the UK for holiday and see friends.
You've been here before?
Yes, I have actually. I come around during the holidays then. But I wanted somewhere different. So I wanted to be in the US or in Australia and Canada. But after I found how difficult it was going to other areas, I have to tell myself, you have to do what's best for you right now and get your journey. I've just been stagnant and I wanted to just leave. So I made that decision to come to the UK, wrote my PLAB exams, and it was brought me here.
PLAB exams, okay. So, after all that process, you're finally, you're preparing for the PLAB exam. Now, for those that are unfamiliar, PLAB exams are something that all junior doctors, internationally trained junior doctors from certain countries have to sit in order to practice medicine within the UK. Preparation normally starts within their own home countries, and then once they feel that they're ready, they come to a centre and sit the exam. That's obviously a very expensive process, and not only is it expensive, it involves a lot of study, and it's almost like you're taking a risk in terms of getting yourself ready for this big exam in a culture that perhaps you're not as familiar with, and it's something that is a big undertaking. So tell me about your PLAB experience. So did you do it in the I know some centers you can do it in Nigeria as well, or you can do it here?
So the first part, which is the PLAB one,
Yeah.
I did that in Nigeria.
Okay.
So it's basically an MCQ questions.
So
only.
that's a multiple choice question
Exactly.
paper. Okay.
Yeah. So I did that in Nigeria, passed that.
Past that. Okay.
Then
Good.
applied to the second step.
Which is OSCE.
Well, yeah, which is OSCE, exactly.
OSCE exam. So
Yeah.
tell me about OSCE exam. How are they different? Because I know some clinicians have OSCE exam, but some areas of med don't. So what is an OSCE exam?
So an OSCE exam is an exam where you have to interact with patients.
Okay.
Yeah, so you have stations where you see a patient, interact with the patient. You have an examiner who is there examining you at the same time.
Yeah.
And the examiner ticks boxes of what you need to ask this patient or what you need to get from this patient based on how you collect the patients, examine the patient, and your diagnosis and management.
Yeah.
So these are the phases of how an OSCE examination is done.
So they're assessing sort of communication skills, you know, your history
Very true.
taking,
Yes.
your examination skills, if you're able to elicit positive signs.
True.
Also, if you're able to do very crucial things like break bad news, whether you're able to, you know, put the patient at ease, explain in layman's terms quite complex medical issues. You know, for example, a new diagnosis of diabetes. Now you're explaining to a patient in layman's terms how this will impact their life, counseling them on why they need to start medication, what's the benefit to them in their life. You know, all of these things, that's what they're sort of assessing in a strictly marked, time limited, high pressure, high stakes situation. So, you know, that's quite nerve wracking, no?
It can be actually. The adrenaline pumping as well.
Yeah.
You know, initially when I started, I remember my first station.
Yeah.
I was my heart was pumping.
Yeah.
I think I messed up in the first station.
Oh, really?
I just blanked out because I was so nervous.
Yeah.
You know, but the second station, I told myself, you need to like pick up, or else you're going to fail this exam. And it's quite expensive.
Yeah.
So I just got myself together and I put through.
Okay. So where was that sat? Was that in the UK?
Yeah, that's in the UK, in Manchester.
Manchester.
Yeah.
Okay, very good.
Yeah.
Great city of Manchester.
Yeah.
Shout out all my Mancunians. So you've passed the PLAB exam. You're excited.
Yeah.
You're ready. You know, you want to enter the NHS.
Yeah.
Were you set on a specialism at that point, or were you just hoping to dip your toes into, you know, clinical medicine in the UK? Or
I think before I started writing the exams back home in Nigeria, I was working as in an oncology hospital.
Oncology,
yes,
meaning cancer.
Yeah, cancer care. Yes,
Okay.
exactly. So I had good experience there prior to coming down to the UK. So after the exams, I obviously wanted to specialize in oncology.
Yeah.
So I applied for jobs there, which I got.
Okay.
Yeah.
So you've got a job lined up. So tell me about, you know, work. Was it a seamless transition into NHS working from, you know, Nigeria? I'm guessing there's a lot of differences, or, you know, what are the similarities as well in terms of, you know, because medicine is medicine. Antibiotic that would work there would work here. You know, certain, you know, pathways are the same, but, you know, there's a culture difference, I'm guessing.
True.
There's a hierarchical difference. There's, you know, MDTs. Perhaps there's slightly different ways, because I've never worked in Nigeria. So tell me a little about.
Yeah, just like you said, there are quite some similarities when it comes to patients' care. It's all the same around the world anyway.
Okay.
But there are certain diseases that are prevalent back in Nigeria that are not here, and certain which are prevalent here that are not back there.
Okay. So give me an example of something that would be prevalent there that would not be that.
Popular malaria.
Okay, malaria. Okay, very good.
Yeah, so malaria is one of them. You have typhoid, you have tuberculosis, and you have some viral illnesses like HIV, hepatitis, and all that.
Okay.
Yeah.
And what about something that's common here that you don't really see?
I think a lot of skin conditions. Yeah, a lot of autoimmune diseases as well.
Autoimmune, so hematology stuff.
Yes, exactly.
Arthritis.
Yes, arthritis. You have sarcoidosis and all that. So we really don't see all that there. Yeah.
And dermatology things like psoriasis.
Yes,
atopy.
exactly. We don't really have a lot of patients who have skin problems back there.
Wow, that's quite interesting. Good to know. So tell me about, you know, your first sort of working week within NHS.
Oh, okay.
It's a big sigh.
Yeah, that was it's something I can't forget. That was challenging, really. You know, something I understood, I found it was they expect you to know.
Yeah.
Everyone expects you to know because you're a doctor. They want you should know.
Yeah.
There's something most people don't understand is you're transitioning from somewhere that is completely different.
Yeah.
The way of life, the way of how we manage things is different from how it's done here. And they expect you to know regardless of where you're from. So that was the challenge, the major challenge I had. Because, coming in straight to the ward, I appreciated all my colleagues who I worked with then, where they tried to support me and all that, but it's still not as easy. Everyone is so busy trying to do this stuff.
Yeah.
I know you'll be left alone to do your own thing. So it was challenging. I think starting from IT, where you need to know,
the notorious NHS IT systems.
You need to know exactly how the system works.
Yeah.
Yeah, and I found that each trust have different computer system of how. So that's one of the main challenges, and the way we manage patients here is different from how it's done there.
Okay.
It's more. I think it's more patient-centered here.
Patient-centered.
Yes, it's more patient-centered.
I think that's a big push within the NHS to get patients involved in their care, and that's something that definitely we're striving towards. Okay, so Celestine, that's very interesting. What you've been talking about in terms of the challenges facing coming into the NHS. Tell me a little bit about, in the UK, we sort of pride ourselves on the multidisciplinary approach to patient care. A lot of allied health professionals working as part of the team. Is that something you were familiar with, all of the roles before you came to the UK, or is that something that was quite new for you? Or tell me a little bit more about that, your experience.
It's big thumbs up to the NHS and how they've imbibed the other allied teams in managing patients. Back home, it's different.
Okay.
Completely different. We only have the nurses who are very involved in patients' care. Majority of the care is doctor-centered.
Okay.
We don't have. We rarely have physiotherapists.
Okay.
Even the occupational therapists as well. They're all privatized, and it's very difficult for patient assessing those care. The healthcare assistants and PAs and all that. We don't have any of that back home. That made a lot of, what I've noticed here is the other teams, which are the PAs and the HCAs, have made it easier for doctors. Yeah. If you look at how it's difficult, even getting a lot of doctors right now to manage to be in hospitals and even in GP practices. Yeah. We have HCAs and PAs who have come in to take some of the roles that the NHS we've been a bit struggling with. Yeah. Back home we don't have that. If there's no doctor, there's no one to do it. So it's difficult, But with what the NHS has done, it's quite a big difference, compared to what I've experienced back home.
Because that's a key push within the NHS sort of workforce planning. So go looking forward projections in terms of the population, what the population needs, and sort of trying to put adequate workforce to sort of stem the needs of that. Obviously, there's new medical schools opening, new roles within the NHS, such as physician associate, which has only been around since 2008, which I'm part of. In order to support the overall joint effort. Yeah. Because the end goal obviously is patient care.
Yeah, very true.
That's the end goal, and we're trying to have the shared goal of providing excellent, efficient, and also cost-effective patient care. And this is the reality of we need to work together as a team. Everyone has subsection of skills. We can lean on either, ask for advice. Perhaps a certain colleague is more experienced in a certain area of medicine, has been there long. We can rely on their colleagues, for insider information, experience that will enable us to develop into better clinicians, not only for the patients, but for teaching as well. I know on the ward, when we have teaching days, we have different allied health professionals, do some teaching because of their area of expertise. They will enable us to impart knowledge onto us. And, I'm glad that you found that, it's been very beneficial for your journey
very.
Into the NHS.
I wish, some other countries can imbibe this.
Oh, yeah.
Really. Yeah, it's made a lot of differences. Yeah.
Okay. Tell me a little bit, you develop your time into the NHS. Initially, you work in hospitals, and now you're on a general practice training program.
That's correct.
General practitioner,
Yeah.
So that's like a family doctor. For those that are unfamiliar, it's probably your first entry into the NHS. The gatekeepers, they're often known as, very well experienced clinicians, and can diagnose and treat all manner of things, just by history and examination alone, which is a remarkable skill to have. So tell me about, general practice. What attracted you, and tell me about the systems of general practice versus secondary care in the UK compared to like the countries you've worked in and got experience in.
Okay, I'll start with how primary care works, here in the UK and back home as well. So primary care obviously is, like you said, is the gatekeeper, for patients to come in, get assessment and all that before we can either do referrals or send down for secondary care or tertiary care. I think we back home in Nigeria and Africa in general, we have the same as well.
Okay.
Well, it's more privatized,
okay.
So it's more private hospitals, and it's quite difficult for patients who don't have money to come in. Yes. Okay. So most times they leave, they leave their problems, like they're unwell and they're not feeling too well. They prefer to stay at home and manage themselves, and at the end they have to go to the hospital. Because when they come to the primary care, it's too late, and sometimes it's something beyond our care control to make a decision.
Yeah.
And at the end, going back to the hospital, they go back to the secondary care, to the hospitals, where sometimes it's difficult to manage them again, and at the end, something fatal happens. But here it's different. Everyone knows what the primary care is, what the GP is, which is the first point of contact. And it's been difficult though, because trying to see everyone at the same time, it's been challenging. But yeah, I think we're doing all right, and the NHS is doing fine to try to combine or get a joint effort between the primary care and the secondary care together.
Yeah, I think that's very, very key, isn't it? In terms of getting the patient population to understand that this is a vital resource, and to go through we were seeing the recent NHS problems in accident emergencies and the big waiting list for surgeries. All of this is unfortunately causing a backlog and causing some patient dissatisfaction. But if we were to compare to health outcomes in some other countries, then the UK still has a very excellent healthcare system.
Yeah,
would you agree?
True. Yeah, I agree.
And for the first instance, it is sort of free at the point of care, which it makes a big difference to people's health outcomes. Their affordability, and it allows healthcare to be delivered at a need basis rather than a ability to pay basis.
Yeah.
So that's a very interesting point.
Yeah, I just want to point out something again before I talk about my reason of the reason why I've decided to join the primary care. Back home, primary care, because of the fact that the secondary care as well, it's underfunded. Most of the primary care tend to do a lot of secondary care work.
Okay.
Which sometimes the facility is not there enough, and patient suffers at the end, because even if you're doing a half-centered work and you're trying to transfer what you've done back to the hospital, is quite challenging and difficult, and sometimes the patient don't make it. So it's something I want to point out, that this is the difference where back home primary care tend to do more than they should do, rather than knowing the limits and pushing the rest to the secondary care. So here it's different, and here in the UK, we in the primary care, we have our limits, and we know when to seek for help and send to the hospitals.
Okay.
Yeah.
So you're mentioning that you're going to talk about primary care. You need to become a general practitioner. You're halfway through your training, is that right?
Yeah, that's right. So currently I'm GP, which is general practitioner, second year.
Yeah.
Here in the UK, it's a 3-year program where you complete and become a certified general practitioner. It was not what I wanted to do. Like I said earlier, it was I wanted to be an oncologist.
Okay.
But when you're trying to be a specialist, you have to decide, is it what you really want to do? You have to weigh your
pros
work is pros and cons, work-life balance as well, which is very important.
Very important. I mean, guys, people underestimate it, but you have to think about are you going to have a family life in the future? The amount of on-calls you're expected to do, and the intense, grueling training pathways that often many different specialties have to to go through. And we're not saying that general practice is an easy way, or it's a simple way, or it's a quick way. Not at all. But you have to consider in broader sense what kind of lifestyle, what kind of going forward, what kind of thing is best suited to your attributes
and what you love as well,
and what you love. Yeah, absolutely.
Very passion is important. Very important. I do have passion being an oncologist. Don't get me wrong.
Yeah.
But I've been in the medical system for quite a while. Graduated in 2013, and I've practiced from then up to now. The reason why I decided to switch was, like I said, work-life balance.
Yeah.
Looking at it, I felt I've given enough already, doing calls and nights and all that for quite a long time, and I wanted time to, start a family. Not saying that being a registrar in oncology would stop from having a family.
It's not impossible, no.
It's not impossible, but personally, this is from my own personal point of view. It can be different for you.
Yeah.
I decided to, back into the journey of being a general practitioner.
So, I mean, if you were to give an overall, like a statement about your overall journey, back home at 18 years, if you could speak to 18-year-old Sel, he's thinking about, becoming an engineer, hindsight is wonderful, 2020. What advice are you going to give to young Sel that this is what, this is the path I took, and, I've done well, or, it was the right thing to do, or, what kind of advice would you give to that young Sel?
You mean if it's me or if someone else?
No, if it's yourself, yeah.
I think I've done well so far. What I would say is keep doing what you're doing, Sel. Chase your dream, and be happy. As long as you're happy what you're doing what you're doing, keep doing it. I think one of the highlights of it is putting smile in patient faces. When I see a patient going back, leaving my office, and smiling and saying thank you, it gives me a lot of joy. And I enjoy what I do. I'm happy doing it.
Very good. How do you like working within the UK and the NHS as a whole? I really enjoy working in the UK.
That's good.
NHS to be precise. Like I started earlier on, the challenges I had from the transition for all the way from Nigeria down here, and how, working in a hospital initially, IT, and, storming into the hospital and everyone taught you know exactly what to do, and you need to ask questions and all that. So, it was difficult, but I pulled through. All the challenges were I didn't have a lot of friends around. So usually I keep in contact on telephone and, video conversation with my family back home. Trying not to, it's quite lonely as well. So it was lonely, very lonely. So every day I come up from work, I'm always on the phone. I am talking to my friends, talking to my parents, talking to my brothers and sisters. So those were the people that kept me going as well, mentally, I would say. Here compared to being in Ukraine, we have a lot of, African stores, Asian stores where you can get varieties of food items you want. So it's not a problem here at all. I don't need to think twice. Like there are restaurants around, especially if you live close to like London, Manchester, you can just walk into any African restaurants and get what you want to eat, or you can order them as well. So those are very good. So far, I think I've done very well, and I've beat those challenges, I would say. Working here, it's quite nice. People are very loving as well, especially when you work in a team of good colleagues and nurses and doctors, PAs, and it's quite interesting. Very helpful as well.
Okay.
And something I always say: when you don't know, always ask questions.
Ask questions.
Yes.
Yeah, that's good advice.
Yes.
So there might be some viewers here that are, international medical graduates, or got some other, degree that was internationally obtained. They're wanting to move to the UK for training, for education, and they're thinking about the move. What kind of advice would you give to these? It's not necessarily for those who are setting PLAB, although it could be possible. But other clinicians wanting to work in the NHS, wanting to bring their skills here. What advice would you give to them as someone who's been through the process and is kind of, flourishing on the other side of it?
Okay. So I think what I would say is it's nice trying to travel abroad or going to different countries to work. But you need to make your decision quickly and fast. The more time you waste, the more time the more time you waste trying to make decisions, the more time you will spend doing nothing.
Yeah.
So if you want to go to the US, you make sure you push for the US. If you want to do that to the UK, you try and push that for that to happen. Well, from my own personal advice, I would tell you that the UK is the easiest. And I would encourage you to come to the UK and work in the NHS.
That's very good. So, from your perspective, the transition, the visa process, it's more straightforward in the UK, would you say?
It's pretty straightforward. I think it's easy. Everything is there on the internet. You don't need to going around looking for answers in different places. Once you go to the government website, you'll see basically everything you need to know.
Gov.uk, that's the website, shout out. It's actually a very good website. So that sort of summarizes your journey into, medicine, into Ukraine as a medical student.
Yeah, from there.
Then foraging into the NHS, coming as a clinician into the system, and now finally you're in a training program. So I would like to thank you for all your insights for today. It's definitely be interesting for me to learn about, from your perspective, from someone who's got a unique insight, from an outsider, can look into the system, and without that tinted as myself, who's born and brought up in the system, can say these are the challenges that we face, and these are the good points as well of working within the UK and also the NHS in particular. So any last sort of words you've got for our viewers, anything that just to encourage them if they're struggling with some revision at the moment, or they're struggling with exams, or they're listening to the podcast and they want that bit of motivation. What can you say to our viewers?
So what I would say is get some of these academies, find them. Pareto is there. They're there to help as well. Look for those well guaranteed academics that can help you through this journey. They're going to make it easy for you. If you think you can do it on your own, but don't get me wrong, if you can do it on your own, but you need this set of gentlemen like my guy Camille is going to help you through and put you through the journey. They'll make it easy, actually. Trust me. Thank you for having me as well, Camille.
Thank you very much.
Yeah, thank you. Yeah.